Hi all, welcome to Physio Exam Buddy. This video is on the high altitude physiology. We will be seeing in detail about the mountain sickness in this video. What is this high altitude physiology? At high altitudes, the barometric pressure is comparatively low when compared to the sea level. The percentage of oxygen in the atmosphere is same at high altitude, that is, it is same as that of the sea level, but the barometric pressure is low. Therefore, the partial pressure of oxygen will be proportionately reduced, and this is the one which is responsible for the hypoxic problems. This was a recently asked essay question in the university exam, that is 18 hours after arrival at an altitude of 12,000 feet. A man has headache, irritability, insomnia, breathlessness, nausea and vomiting. Please note this height, that is 12,000 feet. Only if the person reaches this 12,000 feet, it is the one where the symptoms will begin to appear. So what is he suffering from? So the answer here will be acute mountain sickness. And the other sub questions are, what are the changes taking place in the body systems during acclimatization to high altitude, and also explain the physiological basis of these changes. You can see here that when the altitude level it is zero, that is at sea level, the barometric pressure is usually 760 millimeters of mercury, and this is the partial pressure of oxygen at the sea level, and the alveolar PO2 will be 100 millimeters of mercury at the sea level. And if the person ascends to high altitude, when he reaches 12,000 feet, this is the height which is very important, because it is at this height the appearance of the hypoxic symptoms will begin to appear. And if the person still ascends further and he reaches 18,000 feet or 5,500 meters, and this is the highest level of the permanent human habitation, and above this level the person may require either inhalation of pure oxygen or hyperbaric oxygen if he reaches at 45,000 feet height. The alveolar carbon dioxide as well as the water vapor will usually decreases the alveolar oxygen. That is, the alveolar PCO2. It mainly depends upon the metabolic as well as respiratory activity and not upon the barometric pressure. So PCO2 at the sea level, it is usually 40 millimeters of mercury. And the water vapor pressure in the alveoli, it depends upon the body temperature. So it remains as 47 millimeters of mercury as long as the normal body temperature is maintained regardless of the altitude. And in a acclimatized person at high altitude, the PCO2 can be between in an average of 7 millimeters of mercury. Now about the hypoxic symptoms of breathing air. When the alveolar PO2 falls to 60 millimeters of mercury or below, the peripheral chemoreceptors are stimulated, which will increase the ventilation. And this hyperventilation will decrease the PCO2 because carbon dioxide will be washed out, producing respiratory alkalosis. In an unacclimatized person, the symptoms will begin to appear at 12,000 feet height, and the symptoms include drowsiness, fatigue, dizziness, impairment of the mental function, errors of judgment and memory, as well as decreased discrete motor movements. When he still ascends further, that is when he reaches 18,000 feet height or 5,500 meters, the person may develop severe hypoxic symptoms and seizures can also develop. And above 20,000 feet, that is above 6,100 meters, there may be loss of consciousness as well as death can also occur. We will now see about the hypoxic symptoms of breathing oxygen. One can ascend to higher altitude by breathing pure oxygen. Alveolar PO2 of 100 millimeters of mercury, it is possible at an altitude of 34,000 feet, where the barometric pressure is only 187 millimeters of mercury. At about 45,000 feet height, loss of consciousness, that is, consciousness is lost in spite of the administration of 100% oxygen. So the minimum alveolar PO2 that an unacclimatized person can tolerate without the loss of consciousness, it is around only 35 to 40 millimeters of mercury. At 63,000 feet height, or 19,200 meters. The barometric pressure, it is 47 millimeters of mercury. At or below this temperature, the body fluids will boil at body temperature. So any individual exposed to such a low pressure would be dead of hypoxia before the bubbles of steam could cause death. So in these conditions, an artificial atmosphere, that is an artificial climate, have to be created around an individual where he is in a pressurized suit or cabin supplied with oxygen, and a system for removing the carbon dioxide also have to be arranged. Under such setting, it is only possible to ascend to any altitude. Next is about the delayed effects of the high altitude, and the main problem of the delayed effect is the mountain sickness, which can be acute or chronic. This mountain sickness is occurs in many individuals who ascend rapidly to the high altitude. They may experience irritability, headache, insomnia, breathlessness, nausea, as well as vomiting. And all these symptoms will develop 8 to 24 hours after the arrival at the altitude, and it may last for 4 to 8 days, and it appears to be associated with the cerebral edema. And individuals who do not develop the mountain sickness have diuresis at high altitude, and the urine volume will be decreased in individuals who develop the acute mountain sickness. In detail about the acute mountain sickness, it occurs only in a small percentage of the people who ascend rapidly to the high altitude. The sickness begins from a few hours up to 2 days after the ascent. And the two serious manifestations which you have to explain along with the acute mountain sickness is acute cerebral edema as well as acute pulmonary edema. First, about the acute cerebral edema. Due to hypoxia, the cerebral arterioles will dilate, and there will be an abrupt increase in the cerebral blood flow. And dilatation of these arterioles will increase the blood flow into the capillaries. If there is no autoregulation, there will be an increase in the capillary pressure, which will cause the transudation of the fluid into the brain tissue, and it may cause impaired mental functions. And in high altitude cerebral edema, the capillary leakage can progress to frank brain swelling with ataxia as well as disorientation. And in some cases, coma and death may occur due to the herniation of the brain through the tendurium. Next is about the acute pulmonary edema. Hypoxia causes powerful constriction of the pulmonary arterioles, but only in some part of the lung. So this will cause increased pulmonary blood flow to other areas of the lung where there is still unconstricted pulmonary blood vessels is there. This result in increased capillary pressure, causing the transudation of the fluid into the alveoli. Next is about the management of the pulmonary edema. The first one is to descend to the lower altitude. The treatment with diuretics like acetazolamide. This drug will inhibit the enzyme carbonic anhydrase, and it may produce increase in the bicarbonate excretion in the urine, stimulating the respiration, increasing the alveolar carbon dioxide, and reducing the formation of the CSF. And when there is cerebral edema, large doses of glucocorticoids uh, can also be administered. In high altitude pulmonary edema, prompt treatment with oxygen is essential, and if available, use of hyperbaric oxygen therapy is also recommended. And another drug used for the management is the nifedipine, which is a calcium channel blocker which lowers the pulmonary artery pressure. Next is about the chronic mountain sickness. It occurs in subjects who ascend to high altitude and reside there for long time. And this rare disorder, it is also known as monkey's disease. It is characterized by polycythemia, severe hypoxemia, fatigue, decreased exercise tolerance, pulmonary hypertension, and heart failure. These are the features of the chronic mountain sickness. Hypoxia usually stimulates the erythropoiesis. That is, there will be an increase in the red cell mass as well as the hematocrit, which become exceptionally high. And this polycythemia, it can increase the blood viscosity, which will in turn decrease the tissue blood flow, so that the oxygen delivery also begin to decrease, resulting in stagnant hypoxia as well as cyanosis. Normally, this hypoxic vasoconstrictor effect, it operates to divert the blood from low to high oxygen alveoli. But constriction of the arteriole raises the pulmonary arterial pressure, resulting in the pulmonary hypertension, which can cause enlargement of the right ventricle and resulting in congestive cardiac failure. Spasm of these alveolar arterioles, it can divert much of the blood from non-alveolar pulmonary blood vessels, resulting in poorly oxygenated blood. And most of these people recover within days or weeks when they are moved to a lower altitude. If not, death often follows. So that is about the mountain sickness, both acute and chronic. Thank you.